Hi, this is Dr. Amanda Frank. I'm a pelvic floor physical therapist and owner of Uplift Physical Therapy in San Antonio, Texas. I wanted to come on today to just share what to expect at a pelvic floor physical therapy evaluation. So if you're going in to see a pelvic floor physical therapist, most likely you'll come into the clinic and then you'll fill out a couple of intake forms ahead of time, just so we can get a really good history of what's happened previously, what have you tried, what symptoms are you currently having, and what are your goals. So that will help us create this framework to really understand what is happening with you. Then your physical therapist will bring you back and then we'll deep dive into kind of those details of that intake form, really trying to identify what are the little nuances that makes your situation unique so that we can address whatever's going on with you. After that, your physical therapist will likely bring you through some type of total body movement screen. So that's looking at how is your back moving? What are your hips doing? What does hip strength look like? We'll also look at your core stability. So if you're somebody that's potentially had a baby, we're gonna look and see, are your abs separated or are they together really nicely? What's your pressure situation like? Like, are you using your deep abdominals or just using more of this main six-pack ab muscle, which can contribute to some pelvic floor dysfunction? So we're gonna look at your entire body because the pelvic floor isn't just here. It is affected by everything else, how your feet move, how your jaw's feeling, like everything is connected. After doing the external movement screening, most pelvic floor physical therapists, if indicated, will do an internal pelvic floor exam. So yes, that does mean, so this is my vulva pillow, that does mean internal, so within the vagina, okay? All right, and let's now break down what an internal pelvic floor evaluation is. So this is where a lot of people start to just not really understand and maybe get a little bit uncomfortable about the idea of going to see a pelvic floor physical therapist. Likely your only experience with any type of vaginal exam is at a gynecologist's office. And those are typically kind of uncomfortable for a lot of people. The gynecologist, they tell you to scoot your butt all the way down really close to them. Your legs are open up in some stirrups. And it just feels, there's also a speculum, this like plastic or metal thing that's just, it's really invasive feeling, right? At least I know that's how I feel. So I want to reassure you that at a pelvic floor therapy internal evaluation, it is very different. So instead of having stirrups, you're actually laying on a nice, comfortable bed. So I know in my clinic, I have a bed warmer, you've got sheets on top of you, there's a pillow behind your head, we might have some mood music on. It's a whole different environment. Your legs are not going to be spread open into stirrups. They're either going to be gently relaxed open or supported with some pillows. We do not use speculums either here at a pelvic floor therapy evaluation. So it is way less invasive and usually people are able to relax a whole lot better in these evals. So let's break down the components of a pelvic floor evaluation. So initially, your therapist will likely just observe the external structures. So they're gonna look at your labia majora, minora, and then they may spread open, again, this is with a gloved hand, okay? They may spread open the labia area so that they can visualize this vestibule area or the vaginal opening, okay? After doing that, they will likely have you do a pelvic floor contraction, so try and do a Kegel. They'll have you try and cough to see what reflexively is happening with your pelvic floor muscles. And then they may also have you bear down to look at general mobility of this perineal tissue, which is between your vaginal opening and your rectum. So finding some space into that area to see kind of what's happening. After doing that, they might palpate externally. So you have muscles all along here. So I'll show you on this model. Here's the vaginal opening. There are muscles all along this area between your legs. So with, again, a gloved hand, they'll palpate these muscles on the outside to assess, is there any muscle tension? Is there tenderness? How are you feeling? To just give us some good information. After that, with your permission, usually they will move on to an internal evaluation. So that involves, again, a gloved hand, a little bit of lubricant, typically on their finger. They'll get their finger just a little bit covered in that lubricant. And then again, with your permission, we'll insert one finger into the vaginal opening. Okay, so just inserting one finger. This is a slow process, so if you are nervous or guarded, just don't worry. We won't just shove it in there, okay? It's all going with you in control. So if this is uncomfortable, we go slow. If you ever want us to stop, we stop, okay? No questions asked. So I just want to break down, okay, what are we actually doing internally? So I'm going to take this part off just for visualization purposes. So after the finger is inserted into the vaginal opening, the therapist will likely start to move their finger like a clock around on all of these muscles internally. As they're doing this, they're going to ask you, is this tender? Do you feel anything? Or is it just pressure? They're also going to be assessing how tight or tense is that muscle, just to kind of get a good idea of if these muscles are causing some of your pain or discomfort that you're having. After doing that, they may just move their finger kind of out to the rim, and then they'll have you do a Kegel contraction to see how strong are these muscles. Are you getting a good squeeze around the finger? Is the finger getting a lift kind of in towards the belly button, so bringing it up and in? Just generally looking at the strength. After that, they might have you contract and hold for an extended period of time to look at the endurance of those muscles. After doing the endurance part, most therapists will then end up having you do some quick on and off contractions. So looking at the ability of your body to quickly turn on and off, which will tell us a little bit about what is happening when you need to like cough or sneeze. Again, it's all just really good information. Additionally, after that is completed, if there is a concern for any type of prolapse or dropping or descent of any of your organs, then a prolapse assessment will be completed. So that typically involves the insertion of 2 fingers instead of 1. So we go from 1 finger to 2, and there'll be some downward pressure applied towards your rectum. And then we'll have you bear down. So push like you're trying to poop or fart. If you fart, it's fine. We've had it all happen, so it's not a big deal. If you fart, if you pee a little, no big deal. So that downward pressure, and what we're looking for here is there any type of downward descent of tissue that we notice, okay? After that, fingers come out, gloves come off, we step out of the room, provide you with some baby wipes to clean up, get your clothes back on, and then we'll sit down with you and summarize what did we find throughout our entire exam. What do we think the root cause of all these problems that you're having are, and then establish an individualized treatment plan to address the issues that brought you into pelvic physical therapy in the first place. Moral of the story, the internal pelvic floor exam, it is not scary. Your physical therapist has seen it all. So that means you don't need to go and get a wax if that's not your flavor. Like, it doesn't matter, okay? We don't care what it looks like. All we're doing is assessing what are the muscles doing and how can we optimize those muscles in order to get you back to whatever it is that you really wanted to do. Let me know if you have any questions.